Good morning, everyone. Today I'm joined by Jennifer Woolard, Professor of Psychology and Chair of our Department of Psychology, and she also has a role on our law faculty. And Jen, thank you for taking the time today. Let's get started. With your background in psychology, your work over the years has touched a range of issues from domestic violence and sexual assault to juvenile justice, helping us to reflect on the unique developmental stage of our young people and the experiences of our families. Can you talk a little bit about your research and how we should think about adolescent development? What are some of the key ideas that help to shape your work?
Sure. Jack, first let me say thank you for the invitation to join you for these conversations. I've enjoyed watching them over the past several months, so it's a delight to be with you. I'll start by saying I'm trained as a community psychologist. So the focus in my lab and in my work over the years has really been on how individuals engage with systems and how systems can be more responsive to the needs of individuals and families in our community. So we've really been focused on trying to understand particular systems of what I call care and control. So these are things like the legal system, social services, and so forth, with a particular focus on teens and adolescents, as you mentioned, and young children. So I think one of the important things that I've learned in doing this work over the years, and that has really helped keep me focused when I'm thinking about adolescence, is this importance of the person in context, right? So just like when we talk about our students in the Georgetown context and how meaningful that is, to understand how adolescents are operating in their world, but at the same time, they're still developing, right? We know that the frontal lobe of the brain is still developing well into the 20s. I have 2 children at that age range, so I can say, yes, it is continuing to develop. I'm quite hopeful about that. But really thinking about how, as a society, we can maximize the likelihood that teens and young adults are on a positive trajectory for their lives, and to try to minimize, the harm to themselves or others that they might experience or engage in when they come into contact with the legal system.
Yeah. Now, in your lab, the Community Research Group, you've taken on a number of projects over the years, including projects funded by the National Institute of Justice and the National Science Foundation. Can you share with us a little bit of your lab's work and what it means to connect your research directly to action? How do you see your efforts impacting policies and practices?
Sure. Well, one of the things that we try to do in my lab, which has both undergraduates and graduate students, is to conceptualize the questions we ask with policy and practice in mind, so that the work that we do is informed by true partnerships with community groups in the DC area, for example, that we work with colleagues in the law school faculty and in McCourt Public Policy School, so a really interdisciplinary approach. But that the work that we do can't just stop at the 3rd floor of White Gravener, that we've got to carry it out into the world and figure out how to do that. I've been pretty lucky to be able to do that in a number of ways. So, for example, testifying before state and federal legislatures, right? Doing lots of different kinds of training. I served as the chair of the Virginia State Board of Juvenile Justice, a regulatory agency, for the past several years. That was an incredibly informative window into the regulatory world and the state world, right? And helps me know what I don't know as I'm designing research and the realities of the folks that are in the policy and the practice world, so that we can try to take the research that we've done around, for example, kids and young adults and teenagers' engagement with law enforcement, with probation, with judges, right, with court officials, and really work with our community partners to figure out how can this be useful and what are we missing that we need to ask, that the field wants to know, and that scholars engaged in the community, that's kind of our role, right, is to be able to have this back and forth around bringing the academic knowledge to bear on practice and hearing back the kinds of things that they're facing.
Now, one of your most recent projects centered around the DC court and the use of civil protection orders during the pandemic as a possible method for eviction. What are you finding, and can you tell us more about this work?
Sure. This is a great partnership with a professor at Howard University's law school who is running some legal clinics. And we were really, so I have a broad interest in the notion of access to justice, right? How having attorneys or education can help people as they move through the legal system. And with my background in domestic violence and intimate partner violence, civil protection orders are one of the ways that when two people are having conflict or in danger, that one person can go to the court and ask for what's colloquially called a restraining order, right? That might order the person out of the house, that might say no contact for a certain period of time. And so we, pre-pandemic, we were going down to the Superior Court in DC each week to collect the information that people file those orders, to understand what are the stories that people are experiencing, right? What is happening in their lives, and how does the court respond? And we're particularly interested in whether having an attorney for the person who the order is against, if having an attorney helps them understand what they need to do better and then violate less often. But what we've heard anecdotally in DC and in Virginia, another place we're hoping to work, is with the moratorium on evictions that has essentially been occurring in most states for quite some time, that there's a concern that some people might be using the restraining order process, where you can order a person out of the home for a period of time, as a way to get around that moratorium on evictions. So we're really trying to take an in-depth look at the orders where someone is ordered to go out of the home in the middle of a pandemic, and try to see if we can understand, have those circumstances changed since the pandemic started, and what the impact might be.
Sure, sure. Now, while the pandemic has been challenging on all of us, we know that our young people are facing particular kinds of challenges with the disruptions the pandemic has caused. What are the issues you're most focused on when you think about our young people at this moment?
Sure. I think one of the things I'm focused on most is thinking about connection and community, right? Particularly for our college age students. The in-person connection and interaction can be so important, and it can be challenging to build community in class online, which I think we can do, but almost more important, I think, is the engagement with peers, you know, that they're missing out on. So the other day I was talking with my son, who's a college junior, you know, and he said, "Mom, I really like being with you and Dad, but it's just not the same as being with my friends." And I said, "Believe me, I know." But so that's, I mean, you know, this is where social media and all of the technology can really be helpful, I think, in allowing young people to remain connected in healthy and productive ways during this time of isolation and distance.
Yeah, no. Now, you've been a member of our faculty for nearly 2 decades, and in addition to your research, you've played a role in supporting our safety net on campus, and I know you've thought deeply about how we can address issues of sexual misconduct on campus. What are some of the most important steps we can take in higher education in support of our students?
That's a great question, Jack. And I think about that in kind of two ways. In one way, from my community psychology background, I emphasize the importance of prevention, right? So trying to bring the academic knowledge to bear on the realities of our students' lives, and to think about ways that we can try to prevent incidents from happening, creating a context in which they're less likely to occur, right, and so forth. So we certainly have some intervention programs on the Georgetown campus for our students that they engage in, but I'm encouraged at how our community is thinking about how we can do more and do differently, and to bring the students' voices in as equal partners to figuring out how to do that. The second thing that I really focus on is, when something does happen, how can college communities, university communities respond in ways that balance the need for fairness and protection with supporting survivors, clearly, you know, in the many ways that they need to. So this is something else that, through my work with colleagues on campus, right, we've been really thinking about ways to be able to promote fairness and transparency and understanding while protecting everybody's rights and supporting survivors' needs.
Thank you. Thank you. Now, this fall, you're teaching a terrific class, Building Equitable Societies, with a particular focus on the lives of children. Could you talk a little bit about the class that you're teaching and the way in which you're engaging our students?
Sure. I'm very excited to be teaching this class. It's a great opportunity in the college for co-teaching, right? And so I'm excited to be working with Dr. Rachel Barr in our psychology department and Dr. Phyllis McGrath in psychiatry in our Center for Child and Human Development. And we have different backgrounds. You know, Phyllis, of course, knows everything and everyone in her work on international human rights and health, and Rachel's work on early childhood development and the role of technology and media. And then my work related to the law and the legal system. We came together and said, wouldn't it be great if we could actually spend a semester thinking about how would you create equitable societies for children? Like if you could create it, what would you do? And if you could respond to the inequities that we see, how would you respond? So we've got about 15 first-year students, first semester, which is great. And we're moving through many of the challenges and inequities that families face in the US and abroad. So we've been looking at preterm birth and the challenges families face. We had great folks from Georgetown Medical Center from the Newborn Intensive Care Unit come and speak. This coming week, we're talking about issues of immigration and migration and separation. We've talked about the preschool to prison pipeline and really just engaged, I think, with the students really thoughtfully and creatively. By the end of the semester, they'll be creating an advocacy project based on the research they've read to try and inform others about some of these inequities and what we might do. It's great fun.
That's fantastic. Thank you. Thank you. And thank you for everything you do and everything you mean to our community. I'm grateful to have this opportunity to spend this time together. And in closing, is there one last word you'd like to leave with our community?
Oh my goodness. I guess probably the word community and connection. You know, I think we've worked so hard and it's really been wonderful to see how everyone has come together in this challenging time to make sure that we maintain ourselves as a community going forward. So I just appreciate that about Georgetown.
Thank you. Well, Jen, thank you for sharing your insights today and for your work to ensure we're doing our very best for all of our young people. Thank you. And I look forward to being with all of you again soon. Take care of yourselves and take care of everyone around you. For every Hoya, everywhere.